This is Rebecca. Rebecca has back pain. She came to me and she was in a competition with her husband in terms of who can beat each other running, right? And that she was losing that competition, so she decided to go get help for her back pain. Anyways, she has a herniated disc, so go ahead and extend back, Rebecca. So at what point does it start to hurt? Right about there. So in extension, I would say she's at about 15% or 20% of her range of motion. Okay. So what I'm going to do, so go ahead and lie down on your belly for me here. And let me have you. I always want to get a baseline in when the person's laying here right on the mat, so I can get instant feedback to see how they're doing. Go ahead and press up for me. So at what point did that start to hurt? At what range of motion there? About right there? Now point to me with your fingertip. Right there. So on a scale of 0 to 10, how would you rate that?
Like a 3, 4.
A 3 or 4 out of 10? Okay, go ahead and lay down on your belly. So I'm going to bring this up. Hold on a second. So what I'm going to do is I need to always know, point to me with your fingertip, because I need a place to target with her. So the methods that I do are very precise, and if I have a place to target, then I can usually just shut the pain off and increase her range of motion. Let me just bring this up. So, show me again. The reason why, right in there. Okay, so I'm just going to pick a spot like on her thigh here, and I'm going to use this blue hand tool to save my hands. Is that the only spot that hurt, Rebecca? Or is there other spots there?
Right there. Yeah.
Right in there? Okay. So what I'm going to do is stimulate, this is the myofascial referral technique that I developed. So I'm going to stimulate different parts of her thigh here that connect to that portion of her back. Let's see if we can shut the pain off. Let me know if it's too much, Rebecca, okay? Now press up for me. And better, worse, or same?
Better.
Is it still there?
Like a 1.
So it's a 1 now. So she went from a 3 or 4 to a 1 out of 10. It looks like she has better range of motion. Go ahead and point to me exactly where that you feel that 1. Right there. So she's a little bit lower than she was. So I'm just going to adjust and come a little bit lower here. So I was stimulating about right here. Now I'm going to come about right here and stimulate here. So these are off switches for pain, but they're very precise. So what I did is like here is a map of her low back. So I hit the off switch that relieved pain way up in here, but not so much down in here. So I had to move down and adjust. So go ahead and press up right now, Rebecca. And we're going now. No pain? Okay, so her pain's gone. So now I'm going to have her stand up and we'll check her extension in standing. Hold on one second, let me bring this down. I always do this so people don't jump off the mat. If anybody has had that happen to them, you ask them to get up, but they're really high up. Okay, go ahead and stand up. There you go. So now go ahead and extend back. So much better range of motion. And what about pain?
Very, very, like
a what?
minor, like less than a 1.
Less than a 1? Would you call it pain, or is it like a tightness?
Tightness, maybe, yeah.
Okay, so the tightness, so I always ask, would you call it pain? The reason why I say that is because most people have like a remnants, which I think is more of a nervous system thing where they have an injury there. But if you ask them, would you call it pain? The word pain, they usually say no. And she says it's less than a 1. So it's a little bit of a tightness. So, but her extension is, go ahead, extend back. So you have full range of motion there. So what I'm going to do now is I'm going to follow it up using a different method. So go ahead and lay down on your belly. So I just invented a treatment method that I'm actually developing right now. And this is kind of how it works. Let me see if I have a map here. On my papers. So this is about, so there are, they look like kind of dermatomes in a way, and this is this is kind of the circuit that I'm going to try to hit using acupuncture points. So this is, I'm going to try to target right up in here. So there's a circuit along the way that will do that. So let's see here. She's actually in between two circuits, so I'm going to hit both. So there are points I'm just going to stimulate along the way really quick. So this course I'm developing now, and it'll probably, I don't know, I'm almost done mapping it, but hopefully it'll be out next year sometime, hopefully. So after I do this, what I'm going to do is, I've given her exercises that she does 2 to 3 times a day, right?
Correct.
There you go. So she does exercise 2 to 3 times a day, but what I'm going to do after this is I'm going to follow up the hands-on part of it with electricity at a very high frequency, not like a TENS unit, not like an IFC unit, at a very high frequency. What I can do is, what I can do is stimulate these acupuncture points that connect into her back, and that'll help facilitate the healing process. I come from the standpoint that, Eastern medicine, in the end, everything comes down to the fundamental level, which is energy. And if you go to a good acupuncturist, they can kind of work wonders, kind of like a magician. So what I try to do is stimulate certain acupuncture points that connect to her low back using a very high frequency. And I find you have to use a high frequency. You can't really do it without that. You can't do it by using an IFC unit or a TENS or anything like that. So these are different parts of these circuits. Okay, now go ahead and press up for me. And what about now? Nothing? Okay, let's stand up now. Let me check. And now go ahead and extend back. So that's full range of motion there. And any pain? Nothing? So her pain's totally gone and she's got full range of motion there. So what I'm going to do is, like I said, I'll follow it up with stimulating acupuncture points with certain frequencies. I do a laser, and I also do this device over here sometimes called a scalar device. And then also we do traction too. So that's it.